Here at the first of the week in North Carolina, positive cases are down slightly. Hospitalizations have hit a 2-month high. Is this the fall resurgence so many people have warned us about?
I think we are seeing a fall resurgence, Neil. It has happened less aggressively in North Carolina than in other parts of the country. It is a reminder, though, that as we head into winter, as we try to reopen schools, as people are in closer quarters together, we need to be more, not less vigilant. I am concerned, though, that cases are going to continue to rise, and that people should be worried about that.
So, just so I'm clear, you think early next year we'll have a vaccine?
I think the first authorization could come as soon as late this year, actually, Neil. Now, that won't be for everyone, and there are a lot of vaccines in development. And so, again, it's going to be important to look at all of that evidence that we're going to have a chance to review before anybody needs to make a decision about getting a shot in the arm, and then listening to your health professional who will hopefully have a chance to listen to and take in all this evidence and all the recommendations from the experts that will be coming based on what the clinical trials actually show.
Not only are you a physician, you're also an economist. Given the evolution of the virus here in North Carolina, have we been opening up too slowly, too quickly, or just about right?
You know, Neil, I think the state's taken a pretty prudent approach, and this is a super important issue because the economic consequences of the virus have just been so large, and they continue to be. And if people aren't confident that they can go out and do things safely, that's not going to that's not a reliable way to bring back the economy.
Many public schools here in North Carolina have reopened or are about to reopen over the next few weeks. For the parents out there, how will they know it's safe to send their children back to in-person learning?
So great question. I think the number one thing to look at is just how much COVID is there in the community. And if we can get the rates down so there's not much of a chance of a student or a worker accidentally bringing in a case, then a lot of these cases are asymptomatic. That's one reason to be confident. Second reason to be confident is if the school is taking steps to reduce the risk of spread. And that includes steps like distancing, smaller classes, pods, just a limited number of students staying together or not mixing in as big of groups, masks or other types of face coverings.
I think most people want to know, when are we going to get COVID under control? When is life going to get back to normal? What are your thoughts on this, or is it too early to even be asking those questions?
No, it's definitely not too early to ask you. These are really important questions, and we should be doing all we can to help us get to good answers. First of all, it does depend. It depends on wearing masks. It depends on taking these other steps, continuing to take the virus seriously. All that said, Neil, I think it may get a little bit worse before it gets better over the next 2 months. We've talked about how cases are going up around the country. It's winter, and we haven't all been doing a great job of taking these steps that can reduce spread. But hopefully we'll make some progress on that. But I think as we head into 2021, it is going to get better.